Hi everyone, my name is Awais and today we're going to prepare for the OSCE in which you are asked to take the medical history from the patient. So what you need to do is you need to introduce yourself when you go into the room. So you need to smile and make an eye contact with the patient, and you need to tell them your name and role, and then you will take the consent. So if I have to say that, okay, I'm the pharmacist, so what should I need to mention in the room is that my name is Basic Bar, and so I have my OSCE coming up tomorrow, so that's what I'm gonna say tomorrow. So my name is Basic Bar and I'm the student pharmacist in this university, and then I'll move on to take consent from the patient. So I'll just say that, is it okay to talk about your medication? And then I have to explain to the patient or the carer that why I'm taking their medical history. So you have to make sure basically when you go in those keys or any apart from the medical taking history or any other uh, situation, so you need to use both open and close-ended questions. So you can use open-ended questions that would start with what, why, when, how, and they will end with the closed question. Those require yes or no answers, so you can ask them that. So the main thing you need to focus on is you need to avoid any jargon, any medical jargons. Keep it simple and clarify any vague responses with further questioning or by using other sources of information. So keep the patient at ease, and you may want to look at our patient consultation guide for further help on developing your confidence in consultation skills. And moving on to the next slide, what we need to check uh, while taking the medical history is that we need to check notes for drug history and possible diagnosis. From there you can confirm what actually is the medical history of the patient, medication history, sorry. So obtain consent for GP summary, SCR or GP facts. So you can ask the patient if you can access their record, and then you can check the MR chart. So MR is basically acronym for medication administration record, and then you can also check the history from the admin record or contact care home. Then what you need to ask the patient is about the social history. You can ask them if the patient smokes, how many cigarettes a day, if not, or like if they have stopped recently or they have stopped a while back. So are they on any nicotine replacement therapy, or would they like us to refer them to a smoking cessation service that we are offering? So you can ask all these questions while in the OSCE. Moving on to the next slide, students sometimes ask that what medication they need to inquire about. So it's not only about the medication the patient has been prescribed recently. There are the medication which has been stopped recently or which the patient took for only for acute purposes, maybe any antibiotic or painkillers they've been prescribed recently, or there might be some medication that were prescribed by a specialist. So you need to ask them about all the medication, or there will be some medication they might have bought over the counter, or they might have got from some friends, families, might be some herbal medications, might be some other complementary medication, might be some Chinese medication they might be using. So, and one important thing is that when you are taking medication history, don't only ask about the prescribed medications, ask them about any creams or ointments. Like, not only ask about let me put it this way, don't only ask them about the tablets or liquids they're taking. You can ask them about the inhalers, eye ointments, nebules, nasal drops, anything they are taking. So basically We'll cover all these things in while talking about the medicines, and you will ask them about the contraceptives or HRT as well. So HRT stands for hormonal replacement therapy, and you will also ask them if they are sensitive to any medicine, or sensitive to or has had adverse effects with. Ask about the nature and severity of that reaction. If they confirm that they had any allergy reaction to any medicine, then you need to ask them what was the reaction and what they did about that. Now, how severe was the reaction? So it will tell you that what action you can take or what counseling you need to provide them in regards to that. And then you have to ask them about any dietary supplements they are taking. Or and let's move to the next slide. Okay, so yeah, continuing the question that what medicines should I inquire about. You can ask them about any home oxygen they're using, once weekly medicines they are taking, over the counter recreational drugs, about, like, for example, alcohol and tobacco, and apart from that any other recreational drugs, remedies they are purchased over the counter, or any other when required medicine they're using. So the next part is about what question could I ask. So after asking them about all their medication, dose, frequency, uh, side effects, allergies, you can ask them about the person, or like if they are handling the medication themselves, or anybody else is looking after or the medication at home. So you can ask them about, do you have any difficulties taking your medications? Are they in separate boxes or one big pack? So this is to just get the information that the patient is taking the medication in the original containers, or other medication in the blister pack, or have there been any recent changes to your medicine or any recent hospital admission. Next question would be, do you have any of your own medicines with you? So do you have any in your locker? So if patient has brought medication along with them, you can have a look. You can ask them for that. Would it be okay if I take a look take a look at your medication, whatever you have brought with you? uh, you can ask them if they have any other at home. Do you know how much you have left at home for discharge? Do you get medicines from anywhere other than GP? So any home delivery, hospitals, or like clinical trials, or any other medication, so they will tell you about that. So for each medication you need to establish the generic name of the drug, brand name of the drug, in case they are taking some medication whereby availability variations between brands can have clinical consequences, such as lithium therapy. And you need to make sure what strength of the medicine patient is taking. You need to make sure that dose, both the prescribed one dose and the actual dose the patient is taking, this may best be prescribed to the patient as a quantity of tablets rather than as milligram of active ingredient. Then you need to ask them what formulation they are using at the moment, because in case of phenytoin, 100 milligram of tablet does not deliver the same dose as 100 milligram of liquid. So you need to make sure that you ask the formulation. So we can just recap it quickly. You need to make sure what generic of the drug they're taking. If there is any brand they're taking, then you need to make sure that you ask the brand name, you ask the strength of the medicine taken. You need to establish what dose they're taking, both the prescribed dose and the actual dose the patient is taking. You can ask them about the quantity of tablets they're taking rather than going for the milligrams of active ingredient. And then lastly, you need to ask them the formulation used. So the next slide is about the same thing, about the medicine administration. You need to ask them what route of administration they're using, because sometimes what happens is that we have medicines in the market that they are not licensed for that route, but still they are used, like the ciprofloxacin eye drops. Sometimes they are prescribed for the ear infection, and they are not licensed for that, but that's the unlicensed route they can be prescribed for. But make sure that you tell the patient that the ear drops can't be used in the eye. It's only the eye drops that can be used in the ear, because the eye drops are a sterile preparation, and ear drops are not that sterile. They can't use for the eye. And then the next point you will raise is the frequency of administration. So this should include the time of administration for certain medicines, because certain medicines are best preferred to be taken in the night rather than in the morning. Most of the blood pressure medication are recommended to be taken in the night, because first time when you first take them, they drop your blood pressure, so there were a chance of fall. That's why it's better to take them at night rather than in the morning. And then there are other medication as well which are preferred to be taken at a specific time. And then you will ask them about the length of therapy if appropriate. So if they have been prescribed any antibiotics, you will ask them for how many days have you taken it, and for how many days it has been prescribed, how many days left. So you'll ask them about the length of therapy as well, and then you'll ask them about the administration device and brand of injectables. If they have been prescribed insulin, they'll tell you which device they're using, and what's the brand name of that injectable, day and date of administration for medicine taken on specific days of the week or month. So in case of methotrexate or folic acid, you will ask them specifically the days they have taken those medication, or they are taking those medication. Asked to see any monitoring booklets where applicable, and refer where appropriate. For example, if they are using insulin, you can ask them about the insulin passport. If they're taking methotrexate tablet, you can ask them about the methotrexate booklet. For oral anticoagulants, there is booklet, you can ask for that, and other monitoring booklets as well. So you can ask for all these booklets, monitoring booklets where applicable. And so the next part would be accessing their like sources of information. So you could use the following sources of information when carrying out a medication history for medicines reconciliation. So you can use care home records, community pharmacy patient medication records. So whatever software you're using in the pharmacy, you can use it. You can store the information on those softwares. So PMR. You can use drug treatment center records, GP referral letters, hospital discharge summaries, or outpatient appointment notes, and then you can get the information from the MAR chart, other healthcare professional and specialist clinics. So you can call them up, you can email them, you can get the information from them, but you can't get it without patient's consent. Next would be about, you could use the following sources of information when carrying out a medication history for medication and medicines reconciliation. Again, there are other sources you can use: patient and patient representative, patient GP surgery, patient medical records where available. So for example, in prisons or the emergency care summary in different states, you can have different records. So in Scotland it's emergency care summary care record in England, or Welsh GP record. So patient's medicine, you can actually look at the patient medicine and get the information. Repeat prescriptions, you can check on that. Last part is about the documentation. So you may want to consider documenting the following to support transfer of care and communication. So you need to record the patient's name, hospital NHS number, or apply any address or graph label, regular community pharmacy, drug intolerance, allergy record, including reactions in notes on chart, etc. Date reconciliation carried out, and who by. So you need to initial it, and what sources you use to gather the information, medication history on chart and no sign and date if using patient's own drugs, document each on chart and quantity, and appropriate action taken to rectify any discrepancies. Important discussion had, decision made and why, changes to medicines and reasons, consent obtained to access for GP summary, SCR, or contacting prescriber community pharmacies. Make sure to insert any relevant paperwork into the medication history section of notes. So that's all. So that's what you need to do. Even in your OSCE, or you can actually get the guidance. You can follow all the guidance in your real-time practice as well, like when you'll become a pharmacist, you can use this information just as a guide, um, when you'll be collecting information or you'll be doing a medication history check. So you need to follow all these important points. Thank you so much. See you in the next video.